Welcome to Brainthropology. Let's talk about our amazing brain and the issues that get us stuck. We all have those moments where life gets overwhelming. It can be related to injury or illness, or an issue with your kids, or just because life is crazy and we need a little help and encouragement. Our team of therapists, expert guests, and clients are here to deep dive into the topics that matter most. We will share information with our listeners that encourages, educates, and empowers.
This episode is brought to you by Galaxy Brain and Therapy Center, helping clients live their best lives by implementing strategies such as those discussed in this podcast. Galaxy Brain and Therapy Center is located in Ann Arbor, Michigan, serving southeastern Michigan for in-person and community-based services. Out-of-state virtual and teletherapy services available for OT, PT, speech, mental health, and mindfulness. Check out their website at galaxybraincenter.com.
Hello, everyone. Welcome to the Brainthropology podcast. I'm your host for today, Jessica Smith, and I'm here with Megan Berry. She is a licensed clinical master's level social worker that I'm lucky enough to call my coworker. And also, she's one of those people that just makes you so comfortable that you just instantly call her a friend. Thanks for being here today, Megan.
Thanks for having me.
Today's topic is Medicare, and boy, do we have a lot of information to share about it. Please note that things can change, and they do change year to year, so it's really best to check in with trusted and unbiased sources prior to making any changes to your Medicare plans. But we just want to give you some information to help you through the overwhelming process of really looking at everything. But before we get started, here at Brainthropology, by now, you know we like to start with positives and really encourage people to start their day with gratitude. So, Megan, what has brought you joy this week or something you're grateful? What's your positive today?
That's a great question. And I'm actually going to give you two.
Awesome.
Cheat a little. I got my full licensure this week.
Yay.
So that was definitely one positive. And secondly, I was grateful to finally have an excuse to go to No More Belly Aching Gluten-Free Bakery in Brighton.
Awesome.
So
I like the name of that place.
Me too.
Clever. I will also do a positive. So my positive is we are getting close to boots and sweater and scarf season. And I love scarves. Mm-hmm. So that's my positive, that we're headed that direction. I love fall.
It's very fair. I actually bought fall boots like 2 weeks ago, and it was like a 90-degree day, and I'm like, I'm over it.
Yeah.
Bring on the flannel.
Yep, we're going to fall. So first things first, talk about timing. When does open enrollment begin for Medicare, and what does that term open enrollment really even mean? Walk us through that.
Yeah, so open enrollment is the magical time of the year when people can make changes to their current Medicare plans that they're receiving. Okay. So that period starts October 15th and it ends December 7th. So that's the one window of time that people can change their Medicare plans.
Okay.
Any changes that they make during that time period go into effect January 1st of the next year. So for this coming year, any changes that they make will start January 1st of 2023.
So that October 15th is really right around the corner. So what should people be doing to kind of get ready for that?
Yeah, that's the nice thing is there is a website called Medicare.gov, and you can access that all year round. It explains, you can see what benefits you currently have. You can compare different plans. So my advice for now is if somebody doesn't have a Medicare.gov, now is a great time to create that login. And if they go to Medicare.gov, they click on create an account, they will need their Medicare ID card because they'll have to type in their Medicare number and then also their Part A start date.
Okay.
To kind of get that process rolling.
Good to know. And that's a good place to access any information, and it's really good to have. And if you're not able to create that yourself, maybe ask a loved one or someone to help you create that.
Definitely. And we'll kind of get more into it later in the podcast, but a state SHIP agency. So SHIP stands for State Health Insurance Assistance Program, and every state in the United States has a SHIP provider. And if somebody has technological challenges, is just kind of confused and overwhelmed about this whole process, they offer free, unbiased assistance for all things Medicare. So they could contact their SHIP provider, and they would actually help them create with logging into a Medicare.gov account and walking through the process. They can show them all of the cool things that are on the website and then also help them compare plans.
Wow, that's a great resource. Thanks for sharing that. Okay, so now we know when we have to start paying attention for Medicare changes and make sure we don't miss that open enrollment. Let's talk about what this all means. So Megan, can you give us a basic overview and maybe a definition of Medicare and who really needs to pay attention and know about this?
Yes. So Medicare is a health insurance for people who are 65 years and older, or people who are younger than 65 but have a disability. And that comes into effect if somebody's been receiving Social Security disability income. They're automatically enrolled in Medicare on their 25th month of receiving disability payments. So it's a federal program that provides insurance. Other people who are automatically enrolled in it are people who have end-stage renal disease and people who have ALS as well.
So now we know who qualifies and who should be on the lookout. Let's go back to that Medicare.gov for just a second. And what questions should people start thinking about in order to make some decisions and really kind of get to know some things that they should know going into this whole process?
Yeah, some good questions maybe to ask yourself as you're kind of getting prepared for open enrollment is, what plan do I have right now? Is that plan meeting my needs? Are my prescription costs manageable for me? You know, am I ever skipping out on meds because I can't afford the current prescription costs? Can I see all of the providers that I need to or want to see? Am I going to an in-network pharmacy for my drug coverage? And you can also review your plan's quality star rating on Medicare.gov as well, so you can kind of see how are other people experiencing this plan? Are they having positive reviews?
Nice. Those are good questions to consider. So now we've talked about Medicare. I know that there are some confusion about parts. So you always hear these terms, Part A, Part B, Part D thrown around. I feel like there's really so much information to know about all of it. But let's start with what original Medicare parts are. Can you explain that a little bit for us?
Yeah, it's super confusing that there's so many different letters that go into all of it as well, and it can be very overwhelming. So I would love to break that down a little bit more. So original Medicare consists of Part A and Part B. Part A is considered like your hospital insurance. It covers your inpatient hospital stays, skilled nursing facilities, hospice care, and home health care. And Part B is considered your medical insurance or your outpatient services. It covers things like going to your doctor's appointments or other healthcare providers, the outpatient care, you know, your home health care, durable medical equipment like wheelchairs or walkers, hospital beds, those sorts of things. And it also covers many prevention services, like the screenings that we need to go to and your yearly wellness visit, you know, your physical with your doctor, shots, vaccines, things like that.
Good to know. Good to know. So in terms of costs, and I know costs vary widely, but there are certain deductibles and premiums, and I know those also change each year. So we'll get into that a little bit. But can you tell us more about deductibles and premiums for each of those parts?
Yeah, so with Part A, so that's again your hospital coverage or your inpatient coverage, there is a deductible that beneficiaries pay. Like if they were admitted into the hospital, this is what they would have to pay before Medicare starts paying.
Okay.
And that number in 2022 is $1,556. So after that deductible is met, Part A covers up to 90 consecutive days of inpatient hospital stays. And after the first 60 days, there is a coinsurance that applied. So those first 60 days are covered by Medicare Part A after that 1556 deductible.
Okay.
And then you also have 60 lifetime reserve days under that policy as well. So after this deductible is met, it stays for an entire benefit period. And the way that Medicare defines a benefit period is that the first day of the benefit period starts when somebody is admitted as inpatient into the hospital or to a skilled nursing facility, and it ends after you've been out of that hospital or skilled nursing facility for 60 days in a row.
Okay.
So if somebody was home from the hospital, home from a nursing home, after the 61st consecutive day of being home, if they were admitted on that 62nd day, a new benefit period would start, and then they would pay that $1,556 deductible again.
Wow. So much to keep track of, but it's also good to know. And if all of this gets overwhelming, people can reach out, or there's also good resources that Megan is actually going to review. Megan, I think you have more information that after the deductible is met, Part A still continues to cover a period of time in skilled nursing facilities, right? So I'll let you dive into that a little bit.
Yes, and all of this is very much like spelled out on resources online and in the Medicare and You Handbook. So this may be very overwhelming, but just know that you can find this information. You can find there's help available. But so after you've met your Part A deductible, like say in the hospital, if you have 3 consecutive days as inpatient status in the hospital, Medicare Part A will cover up to 100 days in a skilled nursing facility for you to receive like rehab services. You would just have to go to the skilled facility within 30 days of those inpatient stays.
Okay. Good to know. And then let's talk premium. So there is different premiums for the different parts, right? Am I right with that? I know this all gets confusing, but let's talk a little bit about premiums, because people don't always know and expect that amount, and then they're a little bit shocked when it happens.
Exactly, because they think, oh, I have insurance, it should cover things.
Yeah.
But we can break down too what a deductible is versus what a premium is.
Yeah.
So a deductible is what you have to pay upfront before your healthcare coverage is going to kick in and start paying things. And then the premium is kind of more of your monthly charge for having that insurance.
And the deductible really only hits if you use your benefits. So if you go into the hospital or you get care, they don't have to pay a deductible if they're not going into the hospital or getting outpatient care, correct?
Correct.
Okay.
Yes.
Good to know.
There is a Part A premium, but 99% of Medicare beneficiaries do not have to pay a Part A premium, which is good news. And they go by quarters of working. So if you have 40 working quarters of Medicare coverage, you will not have a Part A premium.
Good to know.
Yeah. And the Part B, so again, that's your outpatient coverage.
Okay.
The Part B monthly premium for 2022, the standard amount is $170.10.
Okay.
A lot of times this comes straight out of somebody's Social Security, so people may not always know that they're even paying this.
Oh, interesting.
And then Part B also has an annual deductible, and that's $233. So again, that deductible means that if you do go for care, you will pay that $233 out of pocket before Part B will start covering things.
I understand. Okay, so now what about medications? Isn't there like a separate part for medications or something that we need to consider for medications?
Yeah, so there's Medicare Part D. I always say D stands for drugs.
Yeah, there
as
you
a
go.
way to remember. Part D helps cover the cost of prescription drugs. You join a Medicare drug plan in addition to original Medicare. And again, that's your A and B. Or by getting a Medicare Advantage plan, which we'll talk about in a little bit. Those often have drug coverage included. But the important thing to know about Part D or drug coverage is you can be penalized if you don't have it and then need it later. So even for somebody maybe who isn't taking any drugs when they first are eligible for Medicare, it's good to get a Part D drug plan so that they don't later have a penalty.
And I actually had this situation. I didn't realize what had happened, but I had this situation with a client where she ended up getting Part D afterwards, and she had to pay a pretty hefty penalty each month, right?
Yeah, it stays with you each month for every month that you have Part D.
And it just, so that is really important to consider and good information to know ahead of time, because you can't retroactivate it. Like once you miss that sign up, it's really, it's really a shame.
Yeah. But there are different types of credible drug coverage that do allow you that protection so that you don't have to sign up for a Part D plan. And the way that Medicare describes credible coverage is coverage that is expected to pay on average at least as much as Medicare standard drug prescription coverage. Okay. Examples of this could be current or former employment coverage. So say somebody is still working and they still have employer health benefits. That can count as credible coverage. Okay. Union and other forms of individual health insurance also can count. But when in doubt, you can always ask your current coverage if they're considered as credible. And they should know the answer to that, or go to your HR person if you're still working, and they should be able to answer that for you.
Okay, good to know. That's good information. So it seems like we skipped a letter. We went A, B, D. We skipped Part C. What is Part C? Can you describe that a little bit? It really does get confusing.
It does get confusing. So Part C, which is also known as Medicare Advantage plans, are private health plans who contract with the federal government to provide Medicare benefits. So people can choose to enroll in Medicare Advantage plans instead of having original Medicare. Okay. But they're still considered as having Medicare, which makes it even more confusing.
Yes.
But at a minimum, Medicare Advantage plans have to offer the same benefits as original Medicare, but they can do it with different rules, different costs, and different coverage restrictions. But a nice perk is that they also can offer additional benefits that original Medicare doesn't cover, and that's vision, hearing, dental, things like that.
Okay. And then do you get Part C? So it sounds like your Part C would really cover your A and B. And then what about D? Do you get Part D with, does it clump it all together? How does that work with Part D and Medicare Advantage plans?
So most Medicare Advantage plans include Part D coverage.
Okay.
And that's one benefit of it. So instead of maybe having your Medicare card, your Part D drug plan card, a supplemental card, people who choose to go the route of Medicare Advantage plans typically just have their Advantage plan card.
Okay.
You still will have your red, white, and blue Medicare card, but when you go to the doctor or go to the hospital, you're actually just going to show them your Advantage card.
Okay. And then what about deductibles and copays with those Advantage plans? They don't really follow the same rules we just discussed with original Medicare, right?
Right. So even if you have a Medicare Advantage plan, your Part A and B premiums, if you have the Part A, which is, again, not very many people do have to pay that, that still applies. So you still would pay your premium, but then also the Medicare Advantage plans could also have a premium.
Oh, okay.
Not all of them do. You can find Medicare Advantage plans that have a monthly premium as low as $0.
Okay.
So that's something to consider when you are, in the Medicare.gov doing the plan comparison. Regarding deductibles and copays for Advantage plans, they can vary plan to plan. So that's something that when you're doing the plan comparison that you would be looking at, and that's kind of the main thing that you could be comparing is what kind of coverage, what does the copay look like, what is the deductibles. And this is different from original Medicare, like Part B, because there's a 20% coinsurance when you use your Part B. So you can expect that 20%.
Okay. In Medicare Advantage plans, you mentioned earlier there's potentially some restrictions, though. So can you talk a little bit about that?
Yes. Advantage plans only cover services from in-network doctors or providers. So you can think about it almost like the way that we would think about an HMO. Okay. Is you may have to get a referral if you want to see a specialist. You may have to get prior authorization for different services.
Okay.
And also there may be providers that would be out of network and you wouldn't have coverage. And Advantage plans also are regional.
Okay.
So for people who travel a lot, are looking for coverage outside of maybe their home state, this would be something to consider as well.
And I think it's important to consider when you're talking about an Advantage plan, it really is different than just that original Medicare. So it really gets confusing. You hinted at this earlier, but when someone has Medicare Advantage and they just call a provider and say, hey, I have Medicare, it's really not that original Medicare. So you have to be careful of, does that specific healthcare provider accept your specific Advantage plan when you're making that phone call? Because it is different than just a provider accepting what people term as straight Medicare or original Medicare.
Right. And so this is a way that you can also self-advocate, is you can know what your plan is and communicate that clearly if you're looking for services. So we hear all the time in the clinic of people calling in and they have a Blue Care Network Advantage plan or a Blue Cross Blue Shield Advantage plan, and that helps us know if we take that insurance versus with original Medicare. Any provider that accepts Medicare accepts original Medicare.
Right.
But that isn't always the case when it comes to Advantage plans.
Right. So there's definitely positives and negatives. And
definitely,
we can see why looking at options is really important because everyone is so unique and has specific unique needs. And you really have to factor in, what you're going to be using this insurance for.
Yeah. And it's, all the plans have pros and cons, and it fits for everybody's different situation.
Yeah.
So there's not one that's better than another one. It just is, what are you looking for?
Good. I'm glad we're having this conversation because sometimes the lingo is thrown around and it gets really confusing. And if we can at least help a couple people understand some of the terms and understand what to look for. We're obviously not doing this podcast for, to help specific people choose their specific plan, but we're giving ideas on what's out there.
Yeah, so people can make an informed choice.
Right.
Right. And we haven't even touched in the difference between Medicare and Medicaid, which is a whole other confusing thing, and people don't often know which of the two that they have. Yeah. So I can give a quick definition for that.
Sure.
Medicare is not income-based.
Okay.
So those are the ones of people who are over the age of 65 or they're on disability. They have one of those conditions that we talked about, either the end-stage renal failure or ALS, or they have been receiving disability for 25 months.
Okay.
Versus Medicaid is income-driven. So the two are different.
Different, yeah. That's good to know and good to hear again. So now we've gone through the different parts for Medicare, but I think there's one more option that I've heard about, something called Medigap. Could you give us some insight on that?
Yeah, so Medigap is another option that people have, and it is a Medicare supplemental insurance. So this is something that somebody would get on top of original Medicare.
Okay.
You can't have an Advantage plan and Medigap.
Okay.
But you can have original Medicare and Medigap. And Medigap fills in the gaps, is the one quick way to kind of remember what it is.
And so this is the same as if people talk about a supplemental policy. This is what they're referring to.
Yeah, because it's supplementing the original Medicare.
Okay.
So it's extra insurance that you can buy from a private company that helps you pay your share of cost from your original Medicare. The policies are standardized, and in most states, they're named by letters, like you'll hear Plan K or Plan G. One thing that's important to know is that the benefits in each lettered plan are the same. So no matter what insurance company is selling that plan, it's the same. But the price can differ sometimes.
Oh, so there's different insurance companies that can sell these different plans. Mm-hmm. Good to know.
And so if you decided that maybe the Medigap is the route that you wanted to go, you most likely would have your original Medicare. You would pick a Medigap plan that fits your needs, and we can break that down a little bit later. But you also may need to purchase a separate Part D drug plan if you don't have that credible coverage that we spoke about earlier.
Okay. So we've heard about a lot of letters, a lot of terms, supplemental, Medigap, which are the same. And can you just give us a quick overview on the pros and cons of Medigap and a supplemental insurance policy?
So with Medigap, you can see any doctor that accepts Medicare, and Medigap just fills in those gaps of what your out-of-pocket cost would be, depending on the plan that you choose. You do have to be eligible for original Medicare, to buy into a Medigap plan. One benefit of Medigap is it's pretty clearly spelled out what's covered and what's not covered.
Okay.
You're not going to have as many surprise out-of-pocket expenses in a Medigap plan. It may have a higher premium that you have to pay month to month, but you're going to know if I go into the hospital, all of the plans for Medigap cover Part A coinsurance.
And that's that potential out-of-pocket expense that you would have if you just had original Medicare. So you wouldn't have any surprise bills after a hospitalization if you had that supplemental or Medigap policy.
Yes, correct. And that coinsurance is what kicks in after you've been in the hospital for 61 days.
Okay.
Then you have a daily coinsurance that you would pay on top of that. With a Medigap, that would be covered.
Okay.
Another benefit of Medigap is that if you're traveling a lot, Medigap coverage is more broad than the regional coverage of Advantage plans. And Medigap, some of the plans offer foreign travel emergency coverage.
Okay.
So if you're somebody that travels, you see yourself going overseas, that may be something that's worth looking into.
And there's, I think, a chart. I remember looking at a chart with a client when we were looking at all of these letter options, because you talked about the letters, and even if it's a different insurance company selling that letter plan, whether it's K, M, and the coverage is the same. And so they can go online, I assume, and find that chart, which might be helpful.
Yeah, definitely. It's called the Medicare Supplement Insurance Medigap Plans chart, and we can put that in the show notes.
That sounds great.
It just breaks down the different benefits, and then it has a nice clear view of plans A through N and which one covers what.
So there are obviously a lot of choices. I've been doing this for years and helping clients with this for years, and I'm still overwhelmed by it all. And I still have to look things up. And let's break this down a little bit. What things should people consider if they want to make the best choice on what's right for them and their situation?
And the biggest thing that I can stress is don't ever feel like you have to go through this alone.
Yeah.
There's support available. You have fabulous OTs like Jessica, or there's social workers. There's your SHIP providers. Like, that assistance is out there and available. And there are a lot of Medicare scams that do occur. And so being wise in who you're trusting is helpful. Yeah. And that's why programs like this have been created for unbiased support. So that's the biggest thing. This is a lot of information.
Yes.
But things to consider for like what plan, may be best for you is considering that travel question. Do you travel a lot? Do you travel in the States? Do you travel nationally, out of the country? That may be something worth considering. Is it important to you to know exactly what you'll pay and when you'll pay it? Some people like that. Some people want to know, I'm going to pay a monthly premium, but everything else for the most part is going to be covered. Other people, if you don't utilize healthcare super often, maybe that higher premium amount isn't for you. Maybe you're willing to pay your copay instead of that high premium.
Yeah.
Is it important to you to have extra coverage like vision and dental and hearing as part of your Medicare plan? that's something worth looking into as well. Is it easier for you to have everything kind of all in one, like those Advantage plans? You know, you have your one card instead of having your original Medicare card, your Part D plan card, your Medigap supplement card. If you've bought other dental insurance, having that card. So it's all kind of about what works for you. Another thing worth considering is the current doctors that you're seeing and, you know, the healthcare that you're getting, of making sure that that is in network, so that way you don't have to change a doctor on top of everything else.
Yeah. These are all such good things to really think about and consider prior to this upcoming open enrollment, and making sure you're getting enrolled in the right thing. One thing I also want to stress is using a strategy like putting an alarm or on your calendar. If you're listening right now and you're close to your calendar, or you have your phone, go ahead and put those open enrollment dates in with reminders to start doing your homework now, because getting closer to that December date when it closes is really kind of nerve-wracking and can create a lot of anxiety, having to make this big decision in a rushed manner. So I think one strategy to consider is really giving yourself that time to look at options and to access those amazing resources you talked about.
Yeah, exactly. And, you know, it's end of September, beginning of October is a great time to start looking and familiarizing yourself again with the current plan that you have, and start asking yourself those questions, you know, of what's working for me, what's not working for me, what would I like to see that's better. And then also, if you do think that you might need some assistance, contacting your local SHIP state provider sooner than later is helpful, because a lot of times they'll hold open enrollment events. And during the pandemic, those have often been on the phone or on Zoom. But they do fill up, especially, you know, that first week in December. They tend to be busy.
Okay, and we'll put that SHIP state locator link in the show notes so that people have access to that as well. And the Medicare website we'll also put in the show notes. That really big, large handbook that everyone gets in the mail, I think it says right on there, Medicare and You. It seems, again, probably overwhelming, but can you talk a little bit about that book and just how helpful it can be?
Yes, and that's probably the booklet that you shoved in a drawer, put away somewhere. Now's the time to dig it out, see if you can find it. If you can't, no worries. Just go on to a computer or ask a supportive person. You can type in Medicare and You 2022, and it should pop up. It's the first link for me on Google.
Okay.
So it pulls up this massive booklet that's more than 100 pages long, but it goes through and breaks things down in a rather understandable way of, you know, what are the parts of Medicare? What are the different options that you have? And they have a lot of nice side-by-side comparisons that break down a lot of these points that we've talked about. So don't feel like you have to listen to Jessica and I on repeat, trying to remember all of the things.
Yeah, though you can if you get bored. No, just teasing.
If you need to fall asleep at night.
Yeah. So when in doubt, you can call your local SHIP, that stands again for State Health Insurance Assistance Program. And Megan, can you just go through a couple things before someone calls SHIP, what they might want to consider or make a list of?
Yeah, and for those of you who are local to our Michigan region, our state SHIP provider, their name is the Medicare Medicaid Assistance Program, or MMAP for short, or MAP. And again, that's always free, unbiased Medicare assistance. They can help you with creating that Medicare.gov account, answering any Medicare questions that you have, explain what benefits you have now, help you enroll in other benefits. That's the nice part, is they can actually sit there with you while you're wanting to sign up for a new plan and help you with that process. And they'll also walk you through all of the benefits comparisons to figure out, you know, what Part D plan is for me, or do I want Advantage, or would I rather have a supplemental plan? All of those things. So before you make that call or you schedule that meeting, some things that you may want to do is make a list of what healthcare you currently receive and what healthcare is a high priority for you. So that could be the outpatient clinic that you go to for rehab services. That could be your primary care doctor or any specialist that you see. What benefits are important to you? You can kind of think through that of over the last year, what benefits did I utilize? What ones did I want to utilize, but maybe I couldn't afford? Any questions that you may have, what works for me? And you will want to have your Medicare card in front of you when you are ready, to make that call, because they'll most likely need that information. It's great to have a list of your current medications, because especially if you're looking at the plan finder, when you're looking at those Part D plans, there's actually a section on Medicare.gov where you can input the current medications that you take in consideration when you're looking at the different plans. And it will tell you with the current meds that you take, what would your cost be? And then that also helps you kind of look at what pharmacies may be in network. And so knowing what pharmacy, is most convenient for you, the one that you prefer to use, that is a quick way sometimes that you can save money on those Part D plans. Or a lot of times those plans have preferred in-network pharmacies, which you can find on your Medicare.gov.
And sometimes those are even, you can get them through the mail. So some of the pharmacies are, mail, they'll send it right to your house. So
right. I actually was working with a client once that he was able to save $60 a month just by changing his pharmacy.
Wow.
He went from a local pharmacy to one of the preferred in-network. And sometimes that's just as simple as switching from a Walgreens to a CVS that's right across the street.
Yeah.
So knowing some of those tricks can save you quite a bit of money sometimes.
That's great information.
Mm-hmm. And also, if you have a trusted family member, a friend, a case manager, somebody like a support person for you, it's okay to schedule a time to contact your SHIP provider when that person is available as well. That could be through a conference call, when you're in a session with that person, and have them be there to help you.
2 sets of ears are always better than one, just to make sure you're hearing all of the information, digesting it all, especially when it comes to this information. It's confusing. So
it is very confusing, and I always like to bounce ideas off of somebody. I'm not the best decision maker, so I'm always talking with everyone about I don't know which one to do. And so having somebody else that's listening to that and can help you kind of bounce those ideas off of it. And don't feel like if you do contact your SHIP provider, don't feel like you have to make a choice that day. Mm-hmm. They can tell you the different information and you can sit on it. You can talk about it with your support people, and then you can schedule a call back later and make a choice.
That's good information too. Yeah. That would be how I would have to do it. Gather all of my information, write it all down, think about options, and then call back and do it. So
definitely. I am a pros and cons list kind of person. I have to overthink most situations.
Hey, we kind of get paid for that though.
That's fair. It worked out.
Okay. So now let's talk about these costs we talked about can really add up. And that in and of itself, we've got the decision-making piece that's overwhelming. And then to think how in the world am I going to afford some of this? So if there are people who are struggling to pay some of those Medicare costs, are there programs or is there help there that you know of?
Yes, thankfully there are some programs that people can qualify for that can help cover some of those out-of-pocket expenses. One of those programs is called Medicare Savings Programs, or MSPs. MSPs help pay Medicare premiums and may also pay Medicare deductibles, coinsurance, and co-payments for those who meet the eligibility conditions. Enrolling in MSPs offers relief from these Medicare costs, allowing people to spend their money on other vital needs, food costs, housing, transportation. And for people who are interested to see if they may qualify for a Medicare savings program, you can contact your local Department of Health and Human Services office, And you can also look online and kind of see the eligibility criteria to see if that's something that you could apply for, and then you would apply through your department.
Yeah, and there's, there's various levels of programs there. So I do encourage, if you're interested in that, look, and it never hurts to apply. So you can submit all of your information. Sometimes people think they won't qualify. If you're on the edge, just go ahead and apply. And it's worth, kind of looking into. I know there's different like COVID relief programs and different. So, I would encourage people to apply if they're interested.
Yeah, it never hurts, to look into it or ask maybe a social worker in your life that can help you kind of break through that, or an occupational therapist. Yeah. And there are, like Jessica said, those different levels. So don't write yourself off as thinking, oh, I probably make too much or I have too much in savings. Like, there are a pretty wide expanse of those programs.
Yeah. And then I think there's also some assistance for Part D and medications. Is that right, Megan?
Yeah, there's a program called Extra Help. And this is a program that you would apply through Social Security Administration. You can actually find an online application on the Social Security Administration's website. And this is a federal program that helps pay for some to most of out-of-pocket costs for Medicare prescription drug coverage. It's also known as Low Income Subsidy, or LIS. Okay. And it can offer help by helping pay for Part D premiums, lower the actual cost of your prescription drugs, and a nice perk is that it gives you a special enrollment period. So once a quarter during a calendar year, you can actually change your Part D plan and switch between plans if you receive the extra help. Versus if you don't have extra help, you can only change it during that open enrollment. So it gives you a little bit more flexibility. If something's not working out, you can change it. And additionally, if you qualify for the extra help and you were paying a Medicare Part D late penalty, that actually is eliminated if you get signed up for extra help.
That is very helpful information to know.
Mm-hmm. There was one statistic I saw that, jumping back to the Medicare Savings Program, that only about half of the eligible people are actually enrolled.
Wow.
So these are programs that can really make a big difference.
Yeah. And that's why we shared it on this podcast. I know this one was a little bit different because it wasn't particularly about the brain, and I know we're Brainthropology, but really one of our passion projects for this podcast is affordable health information. And this is so important as we're coming up to this open enrollment period. And a lot of our clients, where we work, but also there's a lot of people out there right now who have a brain injury or a disability, a neurological disability, that are listening here to us, that we want to help through this Medicare process. And so that was really our goal today, was to be a little bit of helpful, give some helpful hints, if you will, for this process, and just some resources out there that will link a lot of those resources in the show notes, and that information will be here. Is there anything else, Megan, that you can think of that you need or want to share?
I think we covered a lot. There's always more with Medicare. So if we didn't cover, a question that you have, feel free to send it in.
Yeah.
Let us know. Contact your local SHIP and ask that question. Thank you for listening to us ramble on about Medicare.
Well, Megan, thank you so much for being here, because you are a wealth of knowledge in this area, and it's a tough area, and you have been so helpful with all of your information. And we hope that everyone found our podcast today helpful. Please again remember that Medicare plans are very specific and individualized, and things do change year to year. Please check in with those unbiased sources for specific needs prior to making any changes in your Medicare plan. We welcome feedback and suggestions on topics for future podcasts. Please go ahead and email and reach out if you have questions or ideas for future podcasts. As always, we encourage you to be courageous and move forward in your day with hope, joy, and purpose. While we love what we do and are as passionate as they come, the information on this podcast and discussion is for educational purposes only and should not replace professional medical advice. Please consult your own healthcare provider if you are seeking medical advice, diagnoses, or treatment for you or anyone else. We do our very best to provide correct information, but please understand science and medicine is ever-changing. We welcome feedback, comments, suggestions, or correction of errors. This disclaimer applies to any guest or contributors to the podcast or blog.